Hi, everyone. Welcome to the Perfect Dose Podcast. I'm your host, Dr. Kristen Herzog, board-certified nurse practitioner and injection specialist. On today's episode, I am very excited to talk about treatment options if you don't want filler. And you might be listening thinking, oh my gosh, all you do is filler. How are you saying this right now? And yes, I do love filler. I am an aesthetic medicine provider, and filler is an amazing treatment option, but it isn't the only treatment option. And in my practice, I love a healthy balance of filler, of biostimulators, of skin tightening treatments, of neuromodulators, which is Botox, Dysport, Daxxify, Xeomin, Juvo, things that help with wrinkles. I love everything, but I always keep in mind with my patients, and I talk to my patients about this, I'm like, what do you want? My job is to tell you all of your treatment options. My job is to tell you what you are a candidate for. So if there's something that you can't get, it's my job to tell you that. My job is to tell you if your goals are aligned with facial harmony, with facial balance, because that's very important. Natural results are key, but it is your job to tell me what you do or do not want. And if you don't want filler, great, that's okay. There are other treatment options, and I'm going to break them down all in this podcast. As you guys know, I am in my natural era, and for those of you watching, you can see I have recently got filler. I got injected with Erica Berry. She's one of my friends and mentors since like 2017. You may know her as Injector Bunny on Instagram. She did my full facial balancing treatment with Daxxify, which is a neuromodulator, and I'm literally having like trouble speaking right now because my lip flip is kicking in. If you know, you know, when it kicks in, it feels freaking crazy to pronounce words and to drink out of a straw. So in fact, I have my drink right here, and I will literally show you guys for everyone watching on YouTube. It's like I can't do it. I have to put it in my teeth to take a sip because my muscle is so relaxed, but I'm going to look bomb in the next couple of weeks. So the other thing I did was I got 5 syringes of filler. I got my chin treated, my temples treated, my cheeks treated. This is the first time that I've had filler since Baby Jacks, because before Baby Jacks, I did get filler like right before I peed on a stick. I'm like, inject my face. I want to make sure I look snatched and good. And then I had Baby. I couldn't get anything done. After Baby, I really wanted to focus on losing my pregnancy weight. I did tirzepatide to help with getting me back to pre-baby weight and to balance out my hormones. I did it to help with my inflammation, my PCOS, all of the things. And I really wanted to focus on doing things that were very natural to help with my skin. And so I really focused on lasers and Sculptra. That's like all I did until I recently got injected with Erica. So I am here to talk about options for people that don't want filler, or maybe you've gotten filler and you're like, you know, I'm really happy, but I'm interested in doing something else or taking a little break. So let's get into it. So there are many treatment options when it comes to aesthetic medicine that aren't filler. There are biostimulators, there are laser treatments, there is microneedling treatments, there are exosomes, polynucleotides, there is PRP or PRF, which is platelet-rich plasma or platelet-rich fibrin. Many treatment options that I'm going to talk about based on aesthetic goals and outcomes. So first treatment that we are going to discuss is PRP and PRF. So PRP and PRF are absolutely amazing. They are autologous. So this is the safest treatment option because it is your own. Now, it's important to understand what this does in areas that I recommend treating. So I get a lot of people that come in because on TikTok, they're like, I have seen Easy Gel injected all over people's faces. Can I get injected with Easy Gel for my whole face? And for those of you listening that don't know what Easy Gel is a form of PRF that is done a little bit differently. So it is spun down, meaning this is what we do. We draw your blood, we spin it down in a centrifuge, and then that blood is going to separate between platelets and your red blood cells, and you'll have your platelet-rich plasma or your platelet-rich fibrin for PRF. And Easy Gel is going to take that to one more step, and it is going to heat and cool to make your PRF more like a filler. So it's going to turn into a gel that is going to add volume. And it's a really awesome treatment option, especially for people that don't want filler. But it's important to understand its limits and what it does. So what is PRF, PRP, and Easy Gel? We just talked about exactly what they are. PRP is platelet-rich plasma. I love PRP when injecting micro droplets in the skin. PRP is going to release growth factors instantly. So you are going to get a little bit more of a swell if it comes to treating the under eyes. And so I don't prefer to use PRP for the under eyes. I like to use PRP for areas like micro droplet treatments. I like to mix PRP with my fillers sometimes. I like to mix it with my biostimulators. So you can do some really fun things with that, but that's for a whole other episode. But PRF and Easy Gel are amazing treatment options for under eyes and smile lines. And the reason I'm limiting it to 2 areas, because yes, you can get it for your whole face, but it's going to be like a waste, because what it does is it stimulates collagen and growth factors. So you are going to get better skin elasticity. You are going to have improved pigment. It is going to help your skin get thicker over time. So areas like the under eyes, it's freaking amazing. You use PRF, you will need multiple treatments because, again, we don't stimulate collagen overnight. And another thing with PRF is we don't know the quality of your own growth factors. So with age, lifestyle factors, genetics, anything, your growth factors are going to decline over time. So you may need more sessions than like if you're 20 years old and you're getting PRF, the quality of your growth factors is going to be freaking amazing at that point because you haven't been on the collagen decline. So PRF is amazing, but it takes multiple treatments to stimulate collagen and everybody's outcomes are different. So I tell my patients, there's a 50% chance you will be obsessed, and there's a 50% chance you're going to be like, I didn't really notice anything. And I have no control of that because I don't know the quality of your growth factors. So that's just a risk or con of this type of procedure. But because of how it works with stimulating collagen and helping increase growth factors, thickening your skin, areas that you will notice it are smaller areas like under eyes and smile lines. If you were to put it in your lips, for example, you could, but it's not going to disperse evenly like a gel filler. So I'm not going to be able to guarantee that I make your lips even after this. The goal is not to add volume because it's growth factors, it's collagen. So when you're swollen, your lips will look freaking amazing, but then it's going to go away and it's not going to last. So I can't shape your lips, I can't define your lips, and I can't guarantee volume over time. And same thing if you wanted me to inject you with Easy Gel for your cheeks or your chin. Well, when you're swollen, you're going to look great because you're adding this volume, but because it's not meant to volumize, it's meant to thicken your skin and it's meant to add growth factors and improve the quality of your skin. It's not going to be ideal to inject this product all over your face. You can, but as a provider, it's my job to tell you what is good for you and what is not. And in my opinion, you're going to spend a lot of money because Easy Gel is going to cost you around $950 a treatment. And if you spend that much money, that's a lot to invest to have temporary results. So I think if you are not interested in filler, you can use PRF and Easy Gel as an amazing treatment option, but areas that you're going to need to treat are going to be under eyes and smile lines. You're going to need to plan for multiple treatments. And then longevity is going to be a little bit less. So I typically see my patients twice a year when we're doing Easy Gel under the eyes or for smile lines instead of once a year like I do for filler. But yeah, it's an amazing option. I love it. Just understanding its limits and what it does is very, very important. And there are also some things to help improve the quality of your PRF and PRP. And so typically I will tell patients to avoid any sugar for 3 days before your treatment and 3 days after your treatment. I will tell my patients to avoid any anti-inflammatory medications like fish oils, ibuprofen, things like that, because we want an inflammatory response. That's how we're going to get collagen stimulation. So you don't want to do something to limit that inflammatory response. You're also going to want to avoid any steroids because steroids' job is to bring down inflammation and we want that inflammation. But avoiding sugar and alcohol and things that cause bad inflammation in your body are things that we want to avoid to improve our PRP, PRF, and Easy Gel outcomes. You can also consider getting an IV hydration before your treatment. That way, your results are even better because you're filling your body with all of these essential vitamins and nutrients that you may be deficient in. So that is a hack. If you're considering this treatment, consider making sure you eat super clean, anti-inflammatory 3 days before. Don't do anything to fight inflammation like ibuprofen, fish oils, things like that. And schedule an IV before your treatment to make sure that you have the most vitamins, minerals, and nutrients as possible before getting your blood drawn. Now, Next treatment that I want to talk about is lasers. And I freaking love lasers. I'm like a junkie when it comes to lasers. I do Morpheus and Cool Peel like way more often than necessary. But for those of you watching, I'm literally wearing nothing but sunscreen and mascara right now. And people compliment me on my skin all the time. They're like, oh my gosh, your skin's so perfect. How do you look like this? And I'm like, laser. I get so much laser. So I really, really believe in it. So if you are wanting to improve your skin, if you have skin sagging and you have areas of like jowling and you're not interested in getting fillers to reposition those jowls and contour your face, you can skin tighten. So let's talk about them. There are multiple lasers all over the market, and I'm just going to talk about the ones that I know are tried and true, the ones that work. So first, most basic laser is going to be Vivace RF microneedling. So RF microneedling stands for radio frequency microneedling. And what radio frequency microneedling does is it stimulates collagen by not only just creating a physical injury in the skin through the needles, like regular microneedling. So regular microneedling, for those of you listening, is working by stimulating collagen by creating injury in the skin. So we get this skin pen and we go back and forth in different areas of the skin until you have pinpoint bleeding. And then your body is forced to stimulate collagen. So that treatment is really great. Again, limited if you are not in your 20s because you don't have natural collagen. So you may not see as good of results as somebody in their 20s. If you're listening and you're more mature in your 40s, 50s plus, you're not going to get as good of an outcome with microneedling alone. And that's where the radio frequency comes in. So the radio frequency is going to use heat to stimulate collagen. And the needles in RF microneedling are not working to just create injury, but they're working to drive the radio frequency deep into your skin. So think of it as like a collagen sandwich. It's freaking amazing. You're getting collagen stimulation from the injury plus the heat. So if you're listening and you're 30 or older, RF microneedling is the way to go, or microneedling with exosomes or polynucleotides, because I think my opinion is that if you just microneedle alone without a little boost for collagen, growth factors, and peptides, you're going to limit your results. So at Perfect Dose, we don't even offer microneedling without the boost because I am all about biohacking and optimal outcomes. And I know that optimal outcomes means we need to boost microneedling alone with exosomes, with polynucleotides. So that's an amazing option. It's going to be the most cost-effective option. So if you're listening and you're like, well, I'm on a little bit of a budget, then starting with a microneedling exosome or polynucleotide boost is going to be the most cost effective. That on average is around $700. Exosomes are like Amazon Prime packages that deliver growth factors, peptides, and nutrients to your skin. And polynucleotides are PDRNs with glutathione and also hyaluronic acid. So they're amazing for plumping your skin, for softening your skin, for stimulating collagen to help with fine lines and wrinkles. And also the glutathione is really great for pigment. So if you have pigment issues, adding these polynucleotides can really, really help your pigment as well. And then there is RF microneedling. And RF microneedling, there are different devices. The ones that I want to talk about are Vivace and Morpheus. So Vivace is amazing because it's no downtime. So you are going to go to lower depths in the skin than you are with Morpheus. So Morpheus is the best RF microneedling laser, in my opinion, for skin tightening. And that's because it goes the deepest. So Vivace has low downtime because it doesn't go as deep as Morpheus, and it's delivering radio frequency through a single delivery. So radio frequency is going into the skin one time and that's it. Morpheus, the radio frequency is going in and out of the skin. So twice, and it's going deeper. So just kind of pending your goals. If you're like, you know what, I just want collagen stimulation. I want my skin to look brighter. I want to look younger. I have some fine lines, wrinkles that are bothering me. Vivace is awesome. And you're only red for 6 hours. And it's like literally painless because we numb you first. I love that treatment. But if you're looking to actually tighten your skin, you have more skin concerns like jowling, maybe loose turkey neck tissue. We all hate that word, but it is what it is, and it happens with age. If you have some bulking in your submental area, like pockets of fat that are genetic. So some of us just genetically are going to have like a double chin no matter how much weight we lose. I love Morpheus because Morpheus is going to be able to heat up the skin to tighten it. And it also can go deep enough to melt fat. Now, it's important to understand it will not melt fat without intention. So there's a lot of fear mongering out there on social media when it comes to Morpheus, talking about how it melts fat and people got Morpheus treatment and their fat was melted. And that may be true, but it's not because of the Morpheus. It's because of the provider, because the provider has control of the depths. So you need to choose a provider that understands your skin, understands how deep to go and not to go too deep in areas that we want fat. Like in our office, we never do Morpheus deeper than 2 millimeters in your cheeks. Why? Because we need our fat there. We want that. It keeps us young. Areas that we go deeper, like 4 millimeters, are going to be the jawline, the submental area, because we want tightening in that area and we want to melt fat in that area. So those are some really awesome treatments when it comes to skin tightening. Now, what about lasers that help with your pores, with fine lines, with wrinkles? That laser is going to be CO2 laser. That's the gold standard. CO2 is basically going to take off the first layer of your skin. There are different types of CO2 lasers out there. There's like traditional CO2. If you guys all watched Tamra from Housewives of Orange County on her Instagram, she got a traditional CO2. So you look freaking insane. Your face is super red, super swollen. It looks like you've been burned. And then slowly your collagen stimulation happens and you have fresh baby skin. You look amazing. That's an awesome treatment option. I personally don't love that option just because I don't think a lot of people have downtime for that. It's more high risk of infection. So the one that we use in our practice is the Cool Peel, and Cool Peel is amazing because it is a CO2 laser with minimal downtime. And there are a lot of head-to-head studies that show that you can get similar outcomes with traditional CO2 and Cool Peel. So that is freaking amazing. And with Cool Peel, it is going to be like a resurfacing laser. So if you're thinking, okay, lasers are sounding pretty good, which one should I choose? This is how you choose. If you want skin tightening, you choose Morpheus. If you're like, I have a lot of texture issues, I have fine lines, pores, you choose Cool Peel laser because that's going to literally ablate the first layer of your skin. It's freaking bomb. If you're like, well, I want some skin tightening, but I don't want the downtime, you're going to choose Vivace. And if you are like me and you're like, how do I get the best freaking result ever? You're going to do both. I love to do a Morpheus with a Cool Peel on top. So you're getting ultimate skin tightening with a Cool Peel on top. So that first layer of your skin is going to be taken off. This does have a little bit of downtime. So I'm going to show you guys, if you're watching right now, this is what I looked like day one after my Cool Peel. You can see I'm like swollen. My eyes look a little crazy. I'm red. But then you can see by day 4, it's like over. I look amazing. So it's downtime for about 48 hours. I tell my patients plan to look like a swollen tomato for 48 hours, but laser is freaking amazing. It helps with skin tightening. It helps with pores, wrinkles, like all of the signs of aging that we're seeing immediately, lasers can fix. So if you are wanting an alternative to filler, you need laser, and you need laser more often than you think if you're not getting filler. So a lot of people will tell you get your lasers once a year. And yes, that's super great. You can get laser once a year. But if you are wanting to be very preventative and corrective, I recommend getting lasers twice a year. So what I do, our protocol is we will typically do a series. So you will plan to do 3 treatments spaced out 4 to 6 weeks apart. And then after that, you'll maintain twice a year. So I do a Cool Peel Morpheus twice a year at minimum. I told you guys earlier, I'm like addicted to lasers. So I've actually done 3 since May. So I'm like, I've done 3 lasers, and I've done it within, what month are we in? November. So June, July, August, September, October, November, 6 months. So I've probably been a little bit extra, but my skin's glowing. So make an appointment with your provider and you can determine what schedule works for you, whether you do it once a year, whether you do it twice a year, whether you do it quarterly. As long as you are planning for these laser treatments, you will be so obsessed with your skin results. Now, next treatment that you can get, and I really talked about treatments from like safest, your own, which is PRF, PRP, to laser, which is minimal downtime. It is still a device, so you're not like putting anything in your body. You're simply strengthening your skin and tightening it with a laser with heat and microneedles. But now I'm going to talk about biostimulators. And biostimulators are injected. However, they are biocompatible and biodegradable. So what that means is once they are injected, and the one I'm talking about right now is Sculptra. Once it's injected, it is going to leave your body within 3 days, and then you are going to be forced to stimulate your own natural collagen. So it's like a fertilizer for all of the collagen in your skin. And that collagen is going to grow over time. So typically you're going to see results anywhere from 6 to 12 weeks. You're going to notice more of a glow on your skin. You will notice that your skin texture is better, that your skin is tighter. This is one of my favorite treatments, you guys, for anybody that's wanting to prevent aging. So if you want to be preventative and you're like, you know what? I just want to stay looking young. I feel like I look really great and I want to maintain that. You need Sculptra. It is like the secret. I am convinced that every single celebrity that says I'm not doing anything is lying, or they're getting Sculptra, so they get away with saying they're not doing fillers because they're getting Sculptra. So one of the two, but Sculptra is an amazing hack. It is natural. It is a biostimulator, so it stimulates your own natural collagen, and it's easy maintenance. So for anyone listening that's low maintenance, which a lot of people that don't want fillers like might be low maintenance, you can do Sculptra once a year. So you need to do 2 to 3 treatments, depending how much volume loss you've had. You need to schedule an appointment and determine how many treatments it's going to take to get you to correction. And then after that, you need once a year. So my rule of thumb is if you're in your 20s and 30s and you're just looking for prevention, you're going to do 1 treatment, which is 2 vials, and you're going to do that once a year. And you're going to do your lasers twice a year. So that's like my secret sauce. And then if you are 40s and over, you will plan to do 2 treatments of Sculptra. So you'll come in, you'll do 1 treatment with 2 vials. 6 weeks later, you'll do 2 more vials. Then you'll do it once a year. And you'll do your lasers twice a year, but you will do the series first, meaning you will first do 3 Morpheus or 3 cool peels or 3 Morpheus with cool peels. That way we can get you to a great outcome and then maintain that outcome. So these are all amazing treatment options. If you don't want to get filler, you can do skin tightening treatments with lasers, with microneedling boosted like exosomes polynucleotides. You can consider PRF and easy gel. You can also consider PRP. Just understanding its limits and that it's kind of a waste of money to inject it in your whole face, but if you want to, you can. A better investment is going to be Sculptra if you're really looking for that volume. If you're like, I need cheek structure, I have volume loss in my cheeks, I'm going to guide you more towards the Sculptra route just because you're going to get 60% collagen stimulation with that. You're going to get a really good outcome. It's predictable. I've been using it in my practice for years, so I understand the product. I understand how it works. Results are absolutely amazing and they last. So Sculptra is definitely a huge option. Now, the only thing if you are not wanting to get filler and you're like, well, I want something for my lips, there is nothing that you can do except for at-home treatments, unfortunately. I don't recommend the Easy Gel or PRF in your lips. Definitely don't recommend Sculptra in your lips. And I don't recommend laser for your lips. So for lips, you need to get something hydrating like the Anfisa lip balm. That is my #1 lip balm. I'm freaking obsessed. I will link it here for you guys. It is absolutely amazing. So just keep your lips hydrated to maintain a youthful appearance. Thanks for tuning in to today's episode. If you are an injector and you want to learn more techniques, follow me on Patreon. If you are listening and you're like, I need to see some before and afters, I want to know more, or I just want to follow you on your everyday life, follow me on Instagram @theperfectdose. I will see you guys next week.